Good afternoon once again. Today is Sunday, the 10th of January 2021, and this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration, or CCSA. So today I'll start first and foremost with the general situation and the number of cases that we have recorded for today right away. So new confirmed cases for today that we have is 245 cases, and out of this 245, 181 cases are cases of local transmission, 43 being from cases found in active case finding, and 21 cases found within the state quarantine system, making the cumulative number of cases for today, January the 10th, 2021, standing at 10,298, as you can see on screen. The number of new recoveries we recorded is 882, making the cumulative number of recoveries 6,428, and no additional fatalities. So as the spokesperson had mentioned and briefed in the Thai language version, we have some observations, and then he also addressed some questions and answers during the Q&A portion. Just to recap some of those observations is that the number of provinces that we have affected by COVID, of course, it was increasing during the past few days, but now it's sort of more stable now. No increase in the number of provinces. But just to let you know that when we tally the number of provinces affected by COVID, in each new province, there might be perhaps only one or a few cases in that province, but we still tally it and we still put it in the list. For example, the one we reported yesterday, the province of Nong Bo Lampu, that was the newest province as of yesterday. And there, in those provinces, for example, there might have been only one or two cases, not meaning that there are multiple cases in the province that we tally. Also, the spokesperson also mentioned about the Mochana application, wherein the SMS alert would be sent to those that have visited high-risk areas. And in reality, in practice, around almost 400 of those SMS messages have been sent to people who have downloaded the application already, in terms of the real situation already, meaning that perhaps it's up to like around 5 million people now who have downloaded the application, which is a very, very good number. So of that number, for each risk area, a number of people have been alerted through SMS. That SMS alerting people about risk areas that they have visited is sent in not only Thai and English, but also in other foreign languages. As an example, the spokesperson showed the SMS in the Myanmar language as well. Another topic that was in the Q&A session and touched upon is about the concealment of information, which we mentioned about that earlier. Of course, if there is an intention to conceal or hide any information from those who have been to risk areas, who are infected or tested positive, there would be penalties for those who conceal information. Not penalties about not downloading the Mochana application per se, but about concealing information as a whole. That's the general idea. And there was also a question about for those who conceal or hide information, or those who are engaged in illegal activities or entered the country illegally, would their COVID treatment costs not be free? Would they have to shoulder it by themselves? The answer to that is it would be, of course, on a case-by-case basis. But the general idea of all of these warnings in terms of penalties or not, the government not shouldering the cost of COVID treatment, all of these are warnings for those who intend to do illegal activities or intend to conceal information as a deterrent, to those people. In general, the spokesperson mentioned that there was a question posed that is the situation of COVID in decline, towards the decline in Thailand? The answer is actually right now that Thailand is at a more or less stable situation in terms of the new wave. You see that in the past weeks, the number per day was higher than the number that we have daily in the past 1 or 2 days. So perhaps in the last week, we had a peak of like 500 or over 500 per day. But in the past 1 or 2 days, or 3 days, we had around 100 or 200 new cases per day. So we might call that stable, and hoping that this stability will stay on for a while as we monitor closely the situation in Thailand. One important recap that I'd like to provide you today is a recap analysis from the as analyzed by the Ministry of Higher Education, Science and Research and Innovation, that the number of Thai people affected after 363 days of the first case. So it's almost a year after the first case of COVID was reported in Thailand. That was the 12th of January 2020. So after the 12th of January 2020 until today, it's almost exactly 365 days. But in terms of 363 days after that date, we have surpassed 10,000. We surpassed 10,000 after 363 days of after the first wave of infection that affected Thailand from March to April of 2020. It took 2 months to effectively contain the virus nationwide. At that time, the local infection was not reported for over 100 days after the first wave subsided, with reported cases found only in state quarantine and alternative state quarantine facilities from inbound Thai and foreign passengers coming into the country. So this was the recap for last year. And most cases of the current wave for this year could be traced back to the infection in December, with high concentration in the eastern part of the country, especially from the Samut Sakhon cluster. We are living in the midst of the new wave. It might be a good idea to look back at what we have achieved so far, the challenges that we still have to work together. So some interesting figures worth recapping since the beginning of the situation. As of yesterday, there were over 10,053 cases in Thailand, reported for almost 1 year. As I mentioned, 363 days, we reached 10,000. Recovery rate is at 55.17%, with 44.16% still undergoing treatment. Fatality rate in Thailand from COVID stands at 0.67%. The source of infection is 71% local transmission and 29% imported cases. You might notice that yesterday the percentage of this might have been different because last year, the imported cases were actually the bigger source of infection because of the inbound flights coming in at the peak of COVID. And those found infected went straight into the quarantine system. So last year, it might have been the imported cases. But tallying it, averaging it with the new wave this year, the source of infection is more on local transmission now. 71% local, 29% imported cases. The oldest patient we have in Thailand was 97 years of age, while the youngest was only 1 month old. The age group afflicted by the virus is 21 to 30 years old. It stands at 26%, followed by those in the age group 31 to 40 years old, standing at 23%. For 41 to 50 age group, 40 to 50 age group, stands at 19%. And the older generation, 51 to 60 years old age group, it stands at 13%. So the most afflicted from the virus is the age group from 21 until 30 years old at 26%. The top 10 provinces with the highest number of cases are Bangkok, Samut Sakhon, Chonburi, Samut Prakan, Rayong, Nonthaburi, Chanthaburi, Phuket, Yala, and Songkhla. And regionally, the highest concentration of cases is within the central region at 59%, followed by Bangkok and Nonthaburi at 28%, and other regions with lower percentages. On another issue is the inter-provincial travel. Now, just some updates on the measures for that. The CCSA meeting yesterday discussed measures for inter-provincial travel, bearing in mind the difficulties people encounter in obtaining travel permits. And it has resolved to facilitate the issuance of travel permits, which can be issued by competent authorities such as village headmen, district chiefs, heads of local administrative organizations, and heads of police stations. For businesses and organizations which require their employees to travel frequently, employers are authorized to issue travel permits, and for government officials, travel permits can be obtained from the heads of their offices. Other measures including for the screening at checkpoints in and out of the 5 maximum controlled area provinces, Samut Sakhon, Chonburi, Rayong, Chantaburi, and Trat, where travelers must go through body temperature check and inspection of symptoms. They'll be advised on the installation of the application, Mochana, and valid and necessary reason and documents to visit places in the provinces remain in effect. And you have on screen for you there an infographic about the procedure that was shown just now, the procedure in terms of inter-provincial travel, and credit to the Bangkok Post. On inter-provincial travel into and out of the other provinces, aside from the 5 main provinces, screening at checkpoints would be similar to those in the 5 maximum controlled provinces, with the exception that they do not have to provide travel permits. So we reiterate the request for the general public for their cooperation in terms of inter-provincial travel. Now, one province in particular, and you have on screen there the official announcement from Phuket Provincial Administration announcing important measures on inter-provincial travel for Phuket in particular. So in traveling to the 5 controlled areas and other provinces, including for Phuket, you must produce a negative COVID-19 test results 74 hours before your departure or to a local hospital to take a test. State your purpose of visit and produce a travel permit, and undergo 14-day home or hotel quarantine under the supervision of the public health official. So for Phuket, you have the official announcement there, and more details, of course, in the websites that we had announced earlier. For example, TAT News has provincial measures websites. So that was, the first one was for the 5 maximum controlled areas, maximum controlled provinces, and other provinces that are in the highly controlled areas, mostly in the Bangkok. Bangkok's in that group, and also in Phuket, as mentioned. So that's for the highest controlled area. Now, for this, some other provinces, you would have to undergo sort of lesser kind of things, but then 14-day home or hotel quarantine under the supervision of public health officials may still be applicable for some provinces other than the ones I mentioned. So for example, if you're traveling from this group of provinces, Tak, Saratburi, Pathum Thani, Ayutthaya, Lopburi, and a number more, the 14 days home or hotel quarantine would still be required under the supervision of health officials. Now, the last group that I'll mention is if you're traveling from this group of 11 provinces, Sukhothai, Uthai Thani, Buriram, Kamphaeng Phet, Nakhon Sawan, Chainat, Phetchabun, Shayapum, Nakhon Ratchasima, Surat Thani, and Phang Nga. These 11 provinces, they require that you must do self-monitoring during 14 days. So as you can see, there are different varying measures for each province, and it's best to check with the TAT News website as well as MOI COVID, which we mentioned earlier. That would have English language information on the measures of each provinces. Yes, and travelers must register themselves online as well. for particular provinces. For example, in Phuket, they have this web, gophuket.com, or report yourselves to the local district administration before undergoing the 14-day quarantine and download the Mochana. So as you can see, quite complicated measures and restrictions for many provinces. But if you must go, of course, you should have the proper reasoning and documents. We discourage inter-provincial travel at the moment, as mentioned quite often, unless very necessary. So I'll move on to the issue about the State Railway of Thailand for the benefit of the audience here who might be traveling. The State Railway of Thailand suspending service in its 42 train routes until the end of February to prevent the spread of COVID. The CCSA had encouraged the public to considering postponing or cancelling or delaying unnecessary inter-provincial travel during this situation to reduce the risk and prevent the spread of COVID. So therefore, SRT, State Railway of Thailand, announced that the 12 weekend sightseeing trains will also be out of service from the 9th of January, and the 30 regular passenger rail services will be suspended starting Wednesday, January 13th. So that's 12 weekend sightseeing trains and 30 regular passenger rail service trains. 12 plus 30, that's 42 train routes. But for more information, please contact the SRT hotline, as you can see, as you saw on screen just now, at number 1690. In terms of travel, in terms of airlines, just in general, that commercial airlines, 5 commercial airlines in particular, came out with policies for affected passengers, including measures for you to be able to change the date or put the credit of your changed flight for a future flight instead. And then we'll have on screen for you the contact number and logos of these commercial airlines, which you can make use of their website in finding more information about their measures in terms of canceling or changing the booking dates with or without fees and the like. Many airlines have also reduced the number of flights per day or per week and temporarily canceled many routes to contain COVID. So please be sure to cross-check with the airlines or travel companies before you make any travel plans. Yes, so I had recapped the spokesperson's the numbers he gave and some observations, and the Q&A session in the beginning. I gave additional information for the English language audience in particular regarding the travel by train and by air. The recap that I gave you is very important. It's actually the end of year recap. I mean, in terms of a one-year cycle recap since January of last year until January of this year. And you can see that it's still an issue that we have to take heed and pay attention to. The age group that's most affected are actually those in the working age in Thailand, and it's the 21 to 30 age group which are most affected in Thailand. So hoping that we will all have the immunity and take care of our health in that regard. In 363 days, we reached over 10,000 cases, hoping this will not expand further. We're at 200 cases per day right now. The key approach for Thailand has been to promote universal precaution, asking the public to practice these preventive measures, DMHTT. Wearing masks all the time, observing personal hygiene, physical distancing, and establishments, of course, they're all aware that they have to comply with measures to prevent the spread of the disease further. Your cooperation with the authorities was key to our success in 2020 and will remain the key to stemming the current wave of the outbreak this year in 2021. So lastly, just to encourage you to all download and use Mochana application. Up to over 5 million people have already downloaded that in Thailand. Our responsibilities are to make ourselves, our family, our community safe from the infection. Therefore, we have to prepare and cope with the ongoing challenges and adjust our lifestyles continuously and accordingly. So please continue to have empathy on each other. Please continue to take care of each other. We care for you, those who call Thailand home, our foreign friends, whatever nationality you are, you're a part of our society here. So thank you very much for your kind attention and have a happy rest of the weekend, and we will see you again tomorrow. สวัสดีครับ
ครับขอบพระคุณนะครับท่านณัฐพานุ